My name is Stephen Jackson and I'm the United Nations Resident Coordinator here in Kenya. We set up the United Nations Public-Private Partnership Platform for the Sustainable Development Goals with the Kenya government in 2017. And we launched it with the purpose of giving birth to innovative partnerships between government and the private sector to help propel Kenya towards the Sustainable Development Goals. It's a way of bringing in much larger amounts of development financing than is possible if the United Nations works alone or if the government of Kenya works alone. So the SDG Partnership Platform works through 4 windows that are directly aligned to the Big Four agenda of His Excellency President Kenyatta. We have a window on agriculture, food security, nutrition. We have a window on primary health care. We have a window on affordable housing, and we have a window on industrialization. Now, of those 4 windows, the window on health is amongst the most successful already. There's nothing more fundamental than health, is there? It's the foundation of everything. And it's really important that we propel Kenya's journey to universal healthcare coverage for everybody by bringing public and private sector actors together and bringing their resources together. That's how we get the revolution, the step change that we're looking for. That window on health under our platform is one of the oldest. It was the first. It is, as I say, about the most successful, and so far we have a pipeline of almost $120 million progressively crowding into this space, and particularly around the provision of primary health care in some of the remote parts of Kenya. One of the astonishing findings was to look at the provision of health services to the poorest citizens of Kenya in the most remote parts of the country, and actually realize that there is a profit-making opportunity in delivery of primary health care to those citizens. And that's surprising, but it turns out to be a multi-billion-dollar opportunity. So you can do good by making money. And so we did a study a couple of years ago jointly with the United States Agencies for International Development and with McKinsey, the management consultants, and showed that there was a $6 billion opportunity in that space to deliver primary health care to Kenyans. And so progressively, that funding has been flowing in now to set up primary health care clinics, starting in Makueni and moving from there. So it's a really exciting example of just how you can put together public and private partnership to deliver on the promise and the ambition of the Sustainable Development Goals. Impact investing is precisely what I've just described. It's where you're looking at the opportunity for investment to make money, but also to make change, to make improvement. And so we have brought together the key actors in the Kenyan impact investing space within the compass of this board. Kenya, by the way, is a center continentally and globally for innovation around investment with impact. There is a constellation here, particularly in Nairobi, of incredible actors around impact investing. So there's really an opportunity to use that and to capitalize on that expertise in order to propel Kenya towards the Sustainable Development Goals. We need to capitalize on innovation. So you need the investment piece, but the investment needs somewhere exciting to go to achieve that impact. So it's those 3 I's, right? Impacting, investment, and innovation. And Kenya is also a center for innovation around sustainable development. I mean, you can almost think of Kenya as the natural laboratory. Was Kenya, after all, that was one of the 2 countries that coined the term Sustainable Development Goals in 2015, shepherding through the process that adopted them. So what we're doing through this innovation hub is crowding in that Kenyan innovation. in the healthcare space, but also in environment and climate, in agriculture and food security, really to get that catalytic effect towards the SDGs. So partnership as opportunity, and partnership as obligation, and partnership as challenge. Right? Partnership as opportunity. We bring together different kinds of expertise and different kinds of investment, right? Public and private, domestic and international, right? So that's the opportunity, and through that you achieve scale. The obligation, well, let's do the maths. In any given year, United Nations Kenya programs about 350 million United States dollars in Kenya. And that sounds like a lot of money. We're very proud of it. But it's nowhere near enough to achieve the ambition of the Sustainable Development Goals. The government, the national government of Kenya, the annual budget, again in US dollars, is about 30 billion. So that's massively larger than what the UN can bring to bear. But it's still not enough. The size of the Kenyan private sector in any given year is about 80 to 90 billion dollars. So if you put those two things together, the public and the private, you're north of $100 billion per annum. Now you're starting to talk about real possibility of impact. So that's the obligation. Where's the challenge in partnership? Well, we all speak different languages. And I don't just mean Kiswahili and English. I mean that when a private sector actor talks about deal size and deal flow, to the UN, that's a language we need to learn. But when we talk about sustainable development, that's a language the private sector, well, increasingly has learned. So there are language and understanding each other's approach challenges in this. There can sometimes be legal and policy challenges, and that's where Kenya government, in partnership with us, has really led on creating an enabling environment to make it easy to come together as public and private actors for partnership. And remember, when we talk about partnership, SDG 17, the last of the 17 Sustainable Development Goals, is on partnership, because from the beginning in 2015, when the Sustainable Development Agenda was adopted, everybody understood, not just in Kenya, but globally, that the ambition of Agenda 2030 was so enormous, you were never going to be able to do it alone. You needed the kind of creative partnership that this partnership platform aims to produce. So what we want to do is broaden. It seems to us that the habit, the practice of public-private partnership is one that has lent itself very well to supporting Kenya's quest for universal healthcare, and that's what we are going to be discussing in this Expo. It's lent itself very well to the quest for food security, and also to boosting Kenya's agricultural and agribusiness export, which is of course massive and impressive. But public-private partnership can be used in principle to propel any one of the 17 SDGs. Right? In the energy sector, in sustainable cities, even in the question of gender equality. One of the most exciting public-private partnerships that we have right now is a development impact bond. We think it's the first in the world, a development impact bond that is devoted to adolescent sexual and reproductive health improvement. So this habit of public-private partnership is something that we want in UN Kenya to bring to bear on everything that we do, and we're just negotiating with government our next 4-year plan. It's called our cooperation framework, and this, I call it a habit, let me call it a muscle. This muscle of public-private partnership will be behind everything that we do in UN Kenya in the next phase, so that Kenya has every chance of reaching the SDGs by 2030.